name's Robert. I'm living with severe haemophilia A. Currently, I am involved with a charity, an HIV charity. That's the biggest thing I'm actually currently doing. I'm a trustee of that.
I'm Richard Woodhouse, haemophiliac with hepatitis C.
Yes, I'm Jack Leahy. I'm 48 years old. I'm medically retired. I've been for the last 10, 11 years. I suppose I'm classed as a house husband.
My name is Bill. I'm 53 years old and I have severe haemophilia B.
My name is Chris Hodgson. I suffer from severe haemophilia. I'm aged now 63.
Before I was really ill, I sort of acknowledged myself as being disabled, I guess. I'd lived a much more active life. I used to run a video unit, so a lot of running around filming and things like that, which was great fun.
Some of the things that are important in my life are my family. My daughter recently made me a grandfather for the first time. I'm thoroughly enjoying that. It's very different from being a dad.
I worked for an electronics company for 11 years before I medically retired. I'm on a medical pension now. I'm an old age pensioner.
There were things like cricket, which I was clearly quite good at, and I practiced in the nets, and then I wanted to play in a game, and the master said, "I'll have to speak to your mother." My mother came back within 24 hours and said, no possibilities, he mustn't play sport. The only thing I could do was swim, play some tennis, but then the tennis was curtailed because in the end the damage to the joints stopped me running.
Had I not had haemophilia, I think I would have liked to have been a bit more of a traveller than I have been. For one reason or another, I've not been able to travel very much during my life.
One of the regrets, apart from not being able to achieve what I wanted to with my life, is, particularly with the virus, it's sort of getting in the way of relationships and making me a bit reluctant maybe to sort of be with someone.
Haemophiliacs get two distinct types of pain, I think. They get the type of pain that you have when you've got a severe bleed. It's very, very severe at times. And there's the more chronic pain that you get with the arthritis that the haemophilia causes.
The main pain that I suffer from now is the awful nagging pain or sort of severe pain that I get from my joints when I walk. They have deteriorated through the years. My knees are fixed now, so that's not so bad. But like today when I'm fishing, by the end of the day, even though I enjoy the fishing, my ankles are absolutely had it, knackered as it were.
Back, lower joints, which are my ankles completely had it. On my back, my neck, and up until recently, my elbows are starting to take the strain now.
My left ankle is the most damaged. I've got about 50% movement. My right ankle isn't quite as damaged, but I get quite a lot of pain from there. A type of arthritic pain.
At the moment, I can feel an ache in my kidney. My knee, where I've just had a joint replaced, is sort of clenching me. My ankles are a bit sore. That's what I'm having now, this minute.
No, mornings are worse for me when I wake up. I have trouble even sitting up in bed without being in a lot of pain. When I wake up, I stuff my face with painkillers, 2 or 3 cups of tea, half a dozen cigarettes, and I'm ready to take on Rambo.
It can really eat into your sleep time, and that ruins the rest of the day, really.
I think it's the knowledge every day that sometime during the day, and particularly if you're very busy or very active, that the pain will have some effect on you.
It can make you feel very, very black indeed. The problem is that it can happen in a way that you're not aware of. It's not like, 1 minute you're down and next minute you're up, or at least not for me. I've found in the past that I just find myself getting deeper and deeper and deeper into darkness and being more and more blue.
Sometimes I'm fighting the pain. I mean, I get up and sometimes and I'm almost in tears because I'm in so much pain. But if I find myself I don't do it, then what's the point? Or what's the point in just sitting there and just being a cabbage?
I think in the 18 months before I had my knee replacement, my knees replaced, I got really quite insular. It was difficult to get about. I couldn't walk very well. I couldn't drive terribly easily. So it was very difficult to get out.
Later in life, I'd been working on a car and I banged my hand, and it was bleeding. But I'd been invited to go fishing that evening, and I went fishing, caught a trout. But by that time, the pain was getting worse and worse.
It made me very grumpy. It made me very depressed. Very depressed.
But the pain was so bad, so intense, that the only way... I didn't know what to do. You didn't know really what to do. So I poured a bowl of boiling water and I plunged my hand in it. Now I knew it was the worst possible thing to do because it would make the bleeding worse, but I had to get rid of that pain.
Dealing with self-pity and anger is not an easy thing. And I think it's an understandable reaction. I mean, we all have it. Everybody has it. But when you feel like you're sort of removed from life through your illnesses and so on, like I do, obviously the self-pity can really get hold of you. And it will never, ever go away. And it's always in a danger that you might go in there. But I try to be positive and try and get on with what I've got.
It's not helpful to be negative about your pain at all, to think that there's nothing you can do about it. It's much more helpful to feel that your pain is manageable, that you can cope with it and have a normal life.
I survived bloody 15 years before there was any drug therapy. And I'm convinced that's because, although I was pretty devastated by it. I was sad and I was angry. And a lot of people, maybe watching this, that are in the same situation as me and with that age group, older, younger, would probably feel the same thing. I think that's something that people that I've met that live with a condition feel the same thing. You feel a lot of anger about that.
I can get angry when I get down or fed up, and I can get angry. I think small things. I mean, if you've got a lot going on, something quite small will trigger the anger.
It's very easy to sort of think that life owes you something, but I just suddenly realised, and it's easy to say, well, why not you? Why should it not be me who's got this and blah, blah, blah. It's easy to say, and you can say to someone, well, there are other people worse than you in the world and blah, blah. But there comes a point when you actually feel that and you actually realise, yes, actually, it's just the throw of the dice. It just happened to be me that got it. Get on with it.
All the time. I get angry with myself. I'm on my own most of the day. When my daughter's at college and my wife's out at work, but sometimes I just sit here and laugh because there's certain things that I can't do. I might drop a pen on the floor and I'd have to get down on my backside to pick it up, but then I can't get back on the chair again because my arms won't allow me. I can't bend my legs to get on my knees to get back up again, and I just sit there and laugh sometimes.
I don't take painkillers that much, really, not compared to some people. And, my doctor says that I should take it more, really. I think, for me, I take some painkillers at night to help me sleep. Not knock me out, but to take the aches and pains away, which can affect your sleep and give you more troubled sleep. And in the daytime, I'll take painkillers to help me if I know that I'm going to be doing something particularly active and I need to walk quite a bit.
They do subscribe that you take them every 4 hours, but that's a joke, really. You could take them every 40 minutes if you could. I try and go the 4 hours, but obviously I can't. But I might go a couple of hours before I take another couple, and then they kick in. I'll probably take double the amount prescribed that I take. But I have been known to take a lot more when I've been in a lot of pain.
I take painkillers now when I have a bleed. I try not to take them other than when I have a bleed, so I don't take any for the arthritic type pain. I take it for the severe pain of a bleed.
I've taken in the past DF118s and pethidine before that, or at the same time. But I tend not to have to do that now, because if I treat the bleed very quickly, and I'm also on a prophylactic dose, so I treat myself twice a week to keep the clotting level up, so that in turn stops the bleeding. So I don't experience much internal bleeding. What I do take is a type of painkiller, an anti-inflammatory.
But the actual painkillers, I really only take sort of one, and it's this type of anti-inflammatory. You know, I take it before and possibly after a particular event that I think is going to cause quite a lot of stress.
The old favourite is the DF118s and coproximol. I do take more DF118s than I do the coproximol, because coproximol is paracetamol based, and I don't like taking too many paracetamol. I mean, the quota is 8 a day, and I try not to go over the top of that. But as for the DFs, then I can take too many of them, like Smarties.
Well, I have tried cannabis in the past, and I must admit it's been quite useful. Mainly, I think, because it doesn't necessarily take the pain away as such, but pain causes you to get very tense. The muscles get very tight around joints, and I found that very helpful, just to sort of mellow you out.
I don't want to get to the stage where I'm taking too many that I self-harm myself. I mean, I've got liver damage as it is already through Hep C, Hep B, Hep A. I don't want to overdo it on the painkillers.
Painkillers sort of take a toll on your body no matter what you do. If you read the instructions, they say shouldn't have with liver diseases, kidney disease, and I had both. So obviously you have to be careful. And also, of course, the stronger drugs do affect your brain, so that you can't think straight. And on top of the hepatitis C, which does your brain in anyway, it's a terrible cocktail, to be truthful.
Yeah, I've been out and about before now, and it's got to the time where I think I should have to take a couple of painkillers, and if I haven't got them with me, then you do start to panic. So that is the signs of addiction.
There's a tendency, or you could easily become quite dependent on it, so that you're relying on the medication rather than relying on yourself, and those are the problem. Of course, the other side effects of it is the fact that some people can become psychologically dependent on medication. Addicted is another way of saying it, and that's obviously a very big problem in it on its own.
7 years ago, and before I had those knee replacements, I was in such severe pain that I was taking 30 or 40 painkillers a day at that stage. I was in a lot of pain a lot of the time. I was at home. I was stuck on the settee most of the time. I couldn't get about, and my painkiller usage just went up and up and up until I was addicted to them for 3 or 4 years, I would say. After I had my knees replaced, that severe pain was taken away. I didn't need as many painkillers, so I was able to cut down, and after 2 or 3 months I was able to get it down to normal usage again.
I don't know whether it's psychological or not, but until I've had my painkillers when I wake up, and it's not until sort of half an hour after that, taking them, that you do feel easy enough to actually come downstairs.
By taking those aches and pains away, you are then able to sort of just do a little bit more. It also takes the stress as well. There are times when you're just completely wound up and you just need to take some painkillers to sort of knock it out.
I wouldn't be able to survive. I'd be sitting in a chair all day long, banging my head against the wall, if we didn't take them.
Specifically, I guess for me, it would enable me to walk more. That is the main problem for me. All the load-bearing joints are knackered in one way or another. And so, if I could, and of course everything that you do involves a bit of walking.
When the pain is really bad, painkillers help you to get on with the things that are important in your life. And being able to do the things that are important to me is my way of coping with having haemophilia.
So I'm trying to get the level right, just to take that edge off life so that I don't get too stressed and start barking and nagging at everybody, which is what tends to happen.
I think that keeping going is quite important for me. I don't like to let people down, so I try not to let my haemophilia and the pain that the haemophilia causes get in the way of my everyday life.
I'll wake up in the morning and almost think the day through and try and have goals to achieve during the day. I think I'm quite a stubborn person. I find it very... I concentrate on something, I decide I'm going to do something, and I'm pretty single-minded, and I have great difficulty deviating from that.
I mean, I don't have any formal religion, I don't sort of follow any particular type, but there's that sort of feeling, there's that belief that things will get better, that you've got hope, and doing something you want to do, I think, makes you feel good.
Yeah, anything that you can do. I mean, even if it's as simple as watching TV or as I do, I try and write stories and things like that.
People use a range of things to distract themselves. People can utilise music, they can do reading, but one of the most important strategies in my experience of the people I work with is actually having a goal. So work is really important, ways of distracting themselves. When they've got a purpose and a goal, that's a really important thing for them to get their minds off the pain.
I like to listen to very loud music, all types of music. I like to listen to book tapes, anything that you can use to distract you.
I flew a glider, I learnt to fly a glider, and then I was invited to be an instructor. And by doing that totally occupied my mind. It gave me a challenge. It was a sport, and I could do it because you didn't need physical prowess to do it.
I was doing French lessons last year. I found that very helpful. Not only did it get me out of the house, meeting people, and also getting my brain working. Well, that was very helpful. And of course, even before I may have been feeling all achy, by the time I finished that, I was feeling quite good and up.
Relax, meditate, chill out. That helps because you feel calmer and you feel better about yourself.
I like my drumming as well. I do that sometimes. I've got some congas, and that's great. It's sort of, again, that relaxes the physicality of it, but it's not too hard on me.
We go out most Saturday evenings and go karaoke. That takes your mind off it. You have a few drinks and have a laugh, and I try and do some Elvis impressions. And
I mean, I work out pretty much. Out of 7, probably 5. Different types of exercise. I try and vary it. Resistance training, cardiovascular, like an exercise bike. I used to do weights. I still do some. I quite like swimming, although I don't go swimming as much as I used to.
Now, exercise can help in managing acute pain by improving joints and muscles back to their sort of pre-bleed or pre-injury status, getting them back to moving the way they should move and getting them as strong as they were beforehand to prevent further bleeding and further damage. And secondly, sort of exercise can help patients with chronic pain by, once again, increasing sort of strength in joints and muscles and increasing or maintaining ranges of movement, which allows people to do daily activities far more easily.
I think exercise is quite important. My orthopaedic surgeon told me when I had my knees replaced that if I didn't use them, I'd lose them.
The training is the nuts and bolts of sort of what an athlete does, and I consider for myself that the training is the nuts and bolts of keeping me together. So I just sort of get on and do it.
I always try to do a lot of walking. I do hydrotherapy twice a week. I try and do exercises in between at home. So yes, I do think exercise is quite important. It's not always possible to do it when you've got a bleed, and you shouldn't beat yourself up about doing it when you've got a bleed. But
people with haemophilia will always have good days and they'll have bad days, and we all know that sort of on those bad days their pain will be worse than at other times, but on the good days their pain will be less, and it's those days then you sort of need to target to try and do an activity or introduce an exercise into their lifestyle. And by gradually increasing that, they shouldn't increase the amount of pain that they're suffering. If they find they're suffering increased pain as a result of participating in an exercise or activity, they're probably doing too much.
One of the best exercises that I've been able to do is to swim twice a week, and doing that has been great. You know, I can swim 20 lengths, and my muscles feel much freer.
I did a sponsor walk recently for Crusade, which was 6 miles. And I'd never actually done the Crusade walk before. It raises money for HIV. Now, last year, I was involved with it, with the support group I'm involved with, but I couldn't do the walk because my joint was not good enough, my ankle joint. This year, I did the walk. Now I had to give myself 1 lot of treatment before, take anti-inflammatories, and 1 lot of treatment after. Okay, but I did 6 miles in 2 hours, and it rained as well. But I did it, and if I, that type of thinking. Last year I didn't. This year I did.
The only way I could cope with it was not to give up, and to try and do as many things as I possibly can. Sport, as leading as normal life as possible, having a good social life, going out to the pub, taking a pretty girl out to lunch. All these things, are important things in my life.
my attitude has always been that if you want to do something, you'll do it, and you're not going to let very much get in the way of doing it.
If there's some kid out there now, or anybody that's in a down period and saying all this has got on top of me, I mean, I've got this far, and I was there 15 years before drug therapy, and I'm still alive. Okay, I might not have much of an immune system, I might be on drug therapy, and I'm not perfect, but I'm still there, and I've still got ambitions, and I've still got drive, and, you shouldn't let that go, ever.
Being able to keep going, I think is important in that it pushes the pain into the background. If you're at home, if you're sitting around at home, just sitting on the sofa watching the TV, the pain can start to take over. Whereas if you keep going, if you try to keep going for your everyday life and the things that are important to you, the pain gets shoved into the background and becomes just a secondary thing that's there, nagging at you in the background. It's not something that's important.